Physicians help patients stay healthy, but who helps physicians manage the business of wellness? You're listening to ReachMD, XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm your host, attorney and Dr. Bruce Bloom, President and Chief Science Officer of Partnership for Cures, a nonprofit that drives cures to patients through repurposing current therapies for new uses. And my guest is Donna Jarmusz, Senior Vice President for Development and Strategic Initiatives of the Chicago-based company Alter+care, a company that manages and finances healthcare real estate. Donna and I are discussing the concept of wellness centers. Donna, welcome to ReachMD.
Thank you for having me, Bruce.
So tell us a little about Alter+care, when it started, what its focus is, and what larger corporation you're a part of.
Alter+care is a subsidiary of the Alter Group, which is a family-owned real estate development company. And Alter+care is a business and capital partner, and we plan and implement ambulatory care strategies to build healthier communities. And we work primarily with healthcare systems, hospitals, and multi-specialty physician groups.
And when you say ambulatory care facilities, how big and how small are we talking about?
They range in size from anywhere from 25,000 square feet to 250,000 square feet. It really depends upon the market demands and the hospital and the community and the physician's needs in a given marketplace.
So what do you do for Alter+care, and how long have you been there, and what other similar ventures have you worked on?
Well, I am fairly new to Alter+care. Formerly, I was a founder and owner of my own company called the IBIS Group, and we developed on a national basis wellness centers for hospitals across the country. And last year, our company merged with Alter+care to bring the new product line of wellness centers to Alter+care. Alter+care, for the past 10 years, has been developing various types of outpatient facilities, everything from medical office buildings, surgery centers, oncology centers, and I brought the wellness component to the Alter+care family of various outpatient centers.
So tell us what you mean by wellness centers. How do they differ from other healthcare facilities?
Wellness centers are unique in that they're integrating clinical and fitness programs. If you were to walk into a medically based fitness center or wellness center, it would look like your typical high-end health club physically. There's an aquatic center, there's locker rooms, fitness floor with cardiovascular and strength equipment, free weights, aerobic studios, other group exercise studios, etc., indoor track. But the difference is the programming aspects. There we implement disease management programs. For instance, if you have diabetes and are trying to manage that disease more effectively, we have a complete program for you, not only exercise, but maybe nutritional counseling, acupuncture, etc. We also require that every member go through a health assessment, and during that health assessment, we take them through, an exercise physiologist takes them through a flexibility testing, submax bike test for test their endurance, or if they're in poor condition or deconditioned, we take them through a treadmill test, and a cardiac risk profile, et cetera, and a lipid profile as well. And as a result of all of this, then they are given an individualized exercise prescription. And as I mentioned earlier, if they do have other chronic diseases, those resources are also pulled together to help them manage their chronic diseases as well.
So is this someplace where somebody would also go for their medical care?
It could be a place that you could go there for medical care. What we've done recently is initially we were developing freestanding wellness centers where we just really concentrated on wellness and medical spas, et cetera. Now we're integrating that with what we're calling a healthcare village, where we have a variety of medical and clinical specialties in addition to the wellness center. If you think of this in terms of a shopping center or shopping mall, the wellness center is the large department store, the anchor tenant, and then we have a variety of services, everything from physician offices, laboratory services, radiology services, specialty clinics, or maybe a sleep clinic, a diabetes clinic, a wound care center, as well as other services, depending on the community, depending on the hospitals and the physician's needs.
If you've just tuned in, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm your host, Dr. Bruce Bloom, and I am speaking with Donna Jarmusz, Senior Vice President for Development and Strategic Initiatives for the Chicago-based company Alter+care. Donna and I are discussing the concept of wellness centers. So how much of a difference in cost would there be between your typical health club and one of these wellness centers that's more focused on your health care as well as your exercise?
It really varies from market to market. Prior to developing one of these centers, we conduct a comprehensive business planning process, and during that process we examine the other offerings in the marketplace. The wellness center obviously has to be market driven. If you charge too much, then people aren't going to be, it's not going to be affordable, or it will be, outpriced in the marketplace. So every market is different. These centers do tend to be a little higher than your average commercial health club, but you are receiving additional services that are included in that membership fee.
So what are those bundled services? What kinds of things, besides what you've already described, the initial assessment, what else is included in that?
Everything is included. There are no additional charges, for instance, for any of the group exercise classes or any of the wellness education classes. All of those are included in the membership.
And is it like a health club where you can get a family membership or the other kinds of things that happen with purchasing into a health club?
Well, these centers are primarily adult facilities. We do have a child care center where parents can drop their children off while they're utilizing the services of the wellness center, or if they have a doctor's appointment, or if they're going through physical therapy or cardiac rehab, which are also part of the wellness center as well, which makes a nice transition. If you've gone through cardiac rehab, if you've gone through physical therapy, then you can transition to a regular membership, and vice versa. If I'm a healthy person and I have knee surgery and then I need to go through rehab, I can go through my rehabilitation right at the same center where I've been exercising on a regular basis and then transition back to a membership situation.
So if that was my situation, I might be paying a certain amount of money just to be using this facility, and then I have knee surgery. Would I be paying a slightly higher rate to get more services and then come back? And how long would that rehab package be?
Well, primarily, our rehab is covered under most healthcare insurance plans. So it would be just as if you were going to a freestanding rehab center or a hospital-affiliated rehab center. So most of the time that is covered by private insurance or Medicare, Medicaid. So you would transition into that mode, and then you would go back to your regular membership if you're already a member, or you could join the wellness center. We also have medical memberships. So when people are going through this health assessment process that I described earlier, if there are several red flags that occur, for instance, if they're completing their health history form, if they check that they've recently had a heart attack or they have high blood pressure or diabetes, those are red flags to the exercise physiologist, and then they would refer this individual back to their primary care physician. And the primary care physician, we would get their permission or their recommendation as to whether this person could join as a member. If the primary care physician says, for instance, that this particular individual shouldn't really be exercising on their own, then we would put them into what we call a medical membership, and that's a 3-month supervised membership where some medical professional is supervising them as when they come to exercise or utilize the facility.
Finance and build these by yourself, or do you do it in partnership with others? And specifically, do you do this in conjunction with any physicians or hospitals or other healthcare associated groups?
These centers are always affiliated with hospitals and or physician groups. We are not healthcare professionals in the same sense. The hospitals and the physicians really provide the clinical and the medical services for these and the wellness programming for these centers. So we are primarily we assist hospitals in developing these centers, planning them, developing them, constructing them. We implement all of the operations for them. We recruit, hire, and train all of the staff members. It's a turnkey development process for developing the facility, the physical facility, as well as the operations for the facility. And then we stay on for about 6 months and assist in the management of the facility. And then after that, the hospital and or the physician's group, whomever is the primary owner of the business, would then continue on their own.
So you mentioned early on that this is to make communities healthier. Tell us some experiences that you've had around building these wellness centers and turning around a community.
Well, I think one of my favorite projects is in collaboration with St. James Hospital in Chicago Heights, Illinois, Prairie State College, and the local municipality, Chicago Heights. It's a very mixed socioeconomic area, and we pulled together all three of these entities, these three organizations, to develop a community wellness center for them. Without having pooled their resources economically, none of these individual organizations would have been able to afford a center in their community. And what we've seen is that people of all sizes, shapes, ethnicities are really utilizing this center very actively. And again, it's a great community resource for these individuals. And a lot of these individuals had chronic illnesses. There's a high incidence of diabetes in this community, heart disease, et cetera. So it really has helped the community and helped the hospital reach the members of the community in a very unique way, whereas without this center, they may not be getting the preventive and wellness information and care, and wouldn't be helping improve their health status as well if they didn't have this facility.
And how many of these facilities have you built around the country?
We've developed 14 successful centers around the country to date.
Have you done any kind of research that shows what kind of impact they have in the communities?
What we have done in some of our projects is we've done two things. One, from the hospital and the physician's perspective, we've done some research to see how many people who have become members of these wellness centers, how that translates actually into physician visits and also into additional outpatient visits, incremental outpatient visits, and inpatient care on an individual basis. And what we found in the several that we studied was that as a result of people in the community having a very positive experience with the wellness center, then they were more inclined to utilize physicians who are on the medical staff of that hospital, and also so it would help increase the physician's number of patients, as well as increasing inpatient admissions by 5% and incremental outpatient visits by about 10%.
I want to thank our guest, Donna Jarmusz, Senior Vice President of Development and Strategic Initiatives of the Alter+care company, for sharing her insights into the Wellness Center concept. I'm attorney and Dr. Bruce Bloom. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your questions and comments. Please visit us at reachmd.com, where you can find our new on-demand and podcast features that will allow you to access our entire program library. And thank you for listening.
Hi, this is Dr. Anya Collier with the University of Maryland in London, and every chance I get, I listen to the channel for medical professionals, ReachMD XM 157.